I was just jotting down some things I wanted to remember to say, and my pen ran out of ink, so this may be shorter than originally intended. The first thing that I think is most important is that we define what we mean by an energy product. I think that caffeine and energy are used synonymously, and that is not the case. And so we need a clear definition of what we mean by an energy product. For example, a lot of the energy products that we have found in our dietary supplement label database contain no caffeine at all. They're simply high-dose B vitamins. So we need to be consistent in a definition, that's one. There are 1,500 products in the dietary supplement label database that have energy somewhere on the label. And there are 157 dietary supplements that have energy as the product name, some of which contain caffeine and some of which do not. The other component that I feel is boring but really important is to get a good database of the amount of caffeine in dietary supplements and in these products. They're required to be listed on the label if they're an ingredient, but the amount is not required to be on the label. And so it's difficult to assess exposure. It's difficult to assess usual intakes of caffeine without such available data. It's also important because at least coming from my perspective, my background is in dietary assessment, to understand that these products are difficult to assess the usage patterns. They may be used episodically, and so they may not be picked up on 24-hour dietary recalls, but they may be used habitually. We don't know. We just don't have those types of information. So we don't even know what the best way to assess these types of products are at this point. In reporting, there may be social desirability issues, as Amelia alluded to. Children might not be telling their parents they're using these products. People might be embarrassed that they're using these products and tend not to report them to their healthcare practitioners or in research studies. Beverages are often forgotten foods in reporting on 24-hour recalls or other types of dietary assessment methods. I think that we talked about the NHANES data on day one. It's a very good tool for monitoring. It might not be the best tool for answering these types of questions. There may be particular groups of individuals who are using these products. And the groups that I'm thinking about are endurance athletes, particular groups of people that aren't represented on those national monitoring surveys. It's also important to note that on dietary supplements, at least, things can be listed as an energy blend. And so we have absolutely no idea what's in that blend. We don't know if it contains caffeine, and we don't know how much. I did do an analysis from the NHANES data looking at the supplement use and energy drink use. And so we have supplement use for 30 days and energy drink use from 2 24-hour recalls. So considering if you used a product on one of those two occasions, you would be considered a user. So using that definition, 2% of the US population had been defined as a user in the years 2007 through 2010. It's most common in males 19 to 30 years of age, where about 5% are users. Most common product used in the United States from the NHANES data is Red Bull, providing an average of 154 milligrams per day to caffeine intakes. Let me see if there's anything on the back of my folder to tell you. So I think that the most critical data need that we have right now is to establish some sort of database, and so that we have some way to analyze all of the reports that we have. And I would like to close with that, and thank you for your time.